I am exactly 2 months out from my shoulder lipoma excision surgery. They took this rather big lipoma off my clavicle here. As you can see, my scar is healing very well. So as far as my recovery status here at 2 months out, I would say that I'm 100% back to normal. I'm able to do push-ups, I'm able to lift weights, as well as all my daily activities. Unfortunately, I can cook and I can clean, I can do laundry and all of that stuff. I am happy to be pretty much back to normal. So that's why I thought I would take the opportunity and just talk to you a little bit more about the scar, because even though I feel fine, I've got full mobility, full range of motion, you know, my body is still healing the scar. As you can tell, my scar is still a little pink. There's still maybe just a tiny tad bit of swelling around this clavicle here. But because the scar is not completely faded, that means that it's not mature all the way. So I can continue to still address this scar just to make sure that it doesn't try to stick to the clavicle right underneath here, as well as become a little bit more of a raised scar. Now, as you can see, my skin is nice and mobile and I can move the skin and my scar is not sticking to the bone, right? So I can move my scar all along this area and all along my shoulder here. As far as sensation goes, it's a little numb, I would say still. I don't have the same sensation here over in this area, even a little bit below. I wouldn't say that's the same sensation that I feel down here. So those little sensory receptors are still trying to come back as well. So when it comes to scar management on the shoulder, or really kind of any part of your body, I like to kind of follow more of a conservative approach. And luckily, I think my physician does too. And most physicians I find don't like you to be too aggressive early on with your scar. There's a lot of tools out there, and there might be a lot of people that think that you need to start rubbing and pressing and pulling and stuff on scars immediately, because they kind of put the fear in you that your scar is going to cause issues and stick. And there's actually a lot of research that shows that simply applying paper tape or a silicone gel sheeting over your scar can really do wonders with flattening the scar, as well as reducing the amount of tension on the surrounding skin. And by reducing the amount of tension on the skin and pull when you are moving, by applying tape or like a gel sheeting, it actually can help reduce the amount of tension or pull on that scar. And when you do that, that scar doesn't constantly have a stress to it. And if it does have a lot of stress to it, then your body kind of goes into a little more of an overdrive with trying to heal that. So then it can lay more scar tissue down because there's a fear that this area is getting a lot of tension and pull and something's trying to open it back up. So especially in the beginning stages, when your skin and that scar is not very strong, it has a very low tensile strength. Tensile strength is the strength of your skin. And whenever you have an incision, for several weeks, that skin strength is low. And in fact, it never gets to 100%. It typically will only get to about 75 to 80% of its max strength. So that's usually a big reason why I don't like to be too aggressive with scars in the beginning. I find that if you just apply either some paper tape or some silicone gel sheeting on that scar, that can help, again, reduce the pull and the tension on that scar. Now, of course, there are other types of applications. You can put vitamin E creams and lotions and different types of scar creams on that area. However, you can't usually do all of that together, right? You can't really put tape on an area that's had lotion, because then the tape's not gonna stick. And your silicone gel sheeting might not stick very well. So just like I mentioned, using paper tape, you can also use steri strips. So steri strips also are made of that micropore or that type of paper tape structure. And those are very good at reducing the amount of pull and tension on the scar as well as all the skin around the scar. So steri strips alone can be very helpful. And in fact, I had 4 steri strips going across my incision, and 3 of the steri strips came off a little bit earlier. However, one steri strip stayed a little longer than the other. And actually you can see that one extra steri strip that stayed on that scar a little longer than those other 3. You can actually see just a very slight difference. That scar seems to have faded a little bit more, doesn't seem to be as noticeable. For me, that showed that just applying some simple tape to the area can do wonders. Now, sometimes I would take the tape off and I really just wanted to have something off of my skin. I would still put a silicone gel sheeting over my scar when I was sleeping at night. I'll put a link below of where you can find some of this silicone gel sheeting. However, it can be kind of expensive, even though you can reuse it a few times and you can wash it just to kind of wash your skin cells off of there. You can definitely reuse it a few times, but after multiple washes and multiple uses, it will eventually not stick. And so then you'll have to cut yourself a little bit more and reuse that. Just for the most cost-effective paper tape or steri strips that are made of that micropore paper tape is kind of the way to go. Now, on a side note, as you can tell, because my incision is on my clavicle here, he actually took into account that if he would have made the incision right here, then that would be something that you would really see and it would really stand out. And he went ahead and made sure that the way he removed the lipoma and actually made the incision is it sits more on top of my clavicle here. So when I'm looking at someone, straight on, you can't really notice it. And in fact, as it continues to heal and continues to mature and lighten up, then I really don't think it's going to be very noticeable. Now, let me know in the comments below if this video helped you. Do please give it a like, and also don't forget to hit that subscribe button below. And let me know if there are other types of videos that you would like to see about scar. And don't forget to check out these videos here that YouTube is suggesting for you. Thanks for watching.